Real news for Americans 50 plus. This is Emeritus News Channel.
Well, thanks, Glenn, and good afternoon, everybody. Today, I'm going to focus mostly on two areas. One is a worrisome spike that we're seeing in serious pneumococcal disease, and I'm also going to do a quick update on vaccine safety findings, as well as the usual quick update on vaccine supply. We don't have flu activity updates today. We're going to publish our usual weekly flu view information on Monday this week, giving all of you a nice 4-day holiday before you digest the flu information. So look for that on Monday, and we'll be updating the press next week. So I want to talk a little bit about a worrisome finding that we've found with pneumococcal disease. We're seeing an increase in serious pneumococcal infections around the country. Flu infections can increase the risk of pneumococcal disease. Pneumococcus is a bacteria that commonly infects the lung or sometimes the bloodstream. In a typical non-pandemic year, most serious pneumococcal infections occur in people 65 and over. In previous pandemics, there has been an increase in pneumococcal infections in younger people. It turns out that in the 2009 pandemic, we are seeing an increase in pneumococcal infections in younger persons. We're looking in our active bacterial core surveillance, what we call our ABCs sites, and it's in those sites that we have seen this increase in what's called invasive pneumococcal disease. That's the serious type of pneumococcal disease where the bacteria invades the blood or other internal sites. On our website, we have more details about this pneumococcal increase. In particular, I want to mention what we're seeing in the Denver metropolitan area. That's one of the 10 ABC sites where a collaborative investigation is ongoing. When they looked at their 5-year average of how much invasive pneumococcal disease occurs in October, the average for 5 years is about 20 cases, but in October 2009, they had nearly triple that number, 58 serious pneumococcal cases. Most of that increase has been in adults under the age of 60, so non-elderly adults 20 to 59. The findings in Denver probably reflect findings that are occurring in other parts of the country where the surveillance hasn't been as intensive. And I think these findings really highlight two things. One, that pandemics put us at risk for not just flu problems, but also bacterial pneumonia problems. And two, they highlight a really important prevention opportunity. There's a vaccine for adults to prevent these serious pneumococcal infections. It's a 23-valent polysaccharide vaccine, the Pneumovax. Unfortunately, only about 1/4 of high-risk adults have received the pneumococcal vaccine in their life. This is a vaccine you pretty much get once as an adult, not every year the way that flu vaccine works. But only 25% of high-risk adults under 65 have gotten that vaccine. Vaccination is the best way to protect against serious pneumococcal infections, and we strongly recommend that adults with chronic conditions like diabetes, emphysema, chronic heart, lung, liver disease take advantage of the pneumococcal vaccine. You can get the pneumococcal vaccine from your doctor at the doctor's offices. A lot of pharmacies and retail centers also offer the pneumococcal vaccine the way they often stock other vaccines. And so I do strongly urge people to sort out whether you're in one of those high-risk groups and talk to your doctor or ask your pharmacist whether you can be vaccinated. Next, I want to turn to the H1N1 vaccine supply. Our supply does continue to increase, and as of today, there are 61.2 million doses of H1N1 vaccine available for the states to order. Still, a little less than 1/4 of that is available as the spray. On Friday, since this past Friday, more than 7 million doses have become available. This is sort of a short week we're having, but that we have made good progress this week. We're expecting to see vaccination efforts really step up as we head into December in concert with these improved supplies. We're likely to see more places, including more doctors' offices, more clinics, able to offer the H1N1 vaccine. Several states are planning major activities after Thanksgiving to promote more vaccination, both efforts at targeted groups like adults with chronic health conditions and children. So stay informed and look for them. We really do think that December will be a big month for vaccination. I next want to give a brief update on the H1N1 vaccine safety situation. Again, there's going to be more information on our website about this, and you can just go to the news part of the website for details. By this point, there are a lot of doses that have been used of the H1N1 vaccine, and so we've gotten the chance to look at a lot of data about adverse events, possible side effects, or just other events that happen after vaccine is given. So far, everything that we've reviewed is extremely reassuring. We had been talking about the H1N1 vaccine being produced and manufactured and made essentially the same way as the seasonal flu vaccine. Well, in our look at all of the safety data here in the U.S. so far, we're seeing patterns that are pretty much exactly what we see with the seasonal flu vaccine. Very reassuring about the safety of the H1N1 vaccines. The number, pattern, and types of adverse event reports that we are getting are pretty much what we see for seasonal flu vaccines as well. Almost all of the reports that have come into our Vaccine Adverse Event Report System, or VAERS, about 94% of those reports are classified as not serious. They're pretty much a sore arm or redness in the arm, a little tenderness, those sorts of things, which are quite common to any injected vaccine. We, in particular, looked in detail at a rare neurologic problem called Guillain-Barré syndrome, or GBS. Now, people have asked us about this over the months past. You know, in 1976, the swine flu vaccination effort in that year was troubled by an increase in Guillain-Barré syndrome. So, in particular, we wanted to look for that. We have 3 different systems that we're using to understand whether Guillain-Barré syndrome is occurring in any kind of excess amount with the H1N1 vaccines. So in a thorough review of these 3 systems so far, we don't see any problems at all. The systems include the VAERS that I just mentioned, our Emerging Infections Program Network sites, and the Vaccine Safety Data Link. Again, there's more information on our website about these systems. Review of those 3 systems shows that there are no indications of Guillain-Barré syndrome safety problems with the H1N1 vaccine. Again, we don't really have problems with the seasonal flu vaccine, so we weren't expecting them, but we knew people were interested and we wanted to look. Currently, 10 reports to VAERS have come in about potential Guillain-Barré syndrome cases. They have been or are under review, and the number of reports, given the number of doses that have gone out there, are not at all notable. The vaccine data so far really suggests this is a safe vaccine. We've also looked in a little more detail at severe allergic reactions, something called anaphylaxis, and again, those are not showing up more commonly than we would expect. So this first report that we're giving you about vaccine safety is very reassuring, and we know that a lot of people have been waiting for this report, and we think it's good news. Going forward, I certainly hope that people will be able to enjoy the holiday coming up. We want you to stay healthy and safe and to travel well. There's a lot of people that are going to be traveling the next few days, myself included, and it's just a reminder to travel only when you're well, and if you or your children are ill, to try to keep them away from other people. Take preventive steps, covering your cough or sneeze, washing your hands, but really enjoy the time with family and friends coming up. Next week and the weeks beyond, we think that vaccination is going to continue to be a focus. I hope that more and more people will want and be able to receive the H1N1 vaccine in the weeks ahead. I also hope that for everyone for whom the pneumococcal vaccine is recommended, that you're able to take advantage of that and protect yourself against that other serious respiratory infection. As everybody knows, the safe and effective vaccines are the best way to protect yourself from infectious diseases like flu and pneumococcal disease. And just want to end with a final sentence to say how thankful I am for this incredible public health, healthcare, and media partnership we've had over the last several months working together to help keep America healthy and safe.